Today I'm going to give a presentation on the topic investigation of common disease outbreaks in sheep and goat. I'm going to discuss about the basic information about the disease outbreak and its investigation, and some of the common diseases of sheep and goat which have the potential to cause outbreak. So first of all, disease. We know that diseases are maybe non-infectious and infectious. And for the causation of disease, number of theories have been given. And out of them, one of the most simplest and popular one is the epidemiological triad, or we can say triangle. And this theory states that for the occurrence of any disease, there is a role of host, agent, and environment. Their presence and their interaction is very much important. Without their interaction, the disease cannot occur in a population, in an individual. There are different factors related with these three determinants are there, which play an important role and involve in disease causation. Whenever there is a disease in the population or in an individual, there is a formation of an equilibrium where there is a host and agents are there, and this is the situation of subclinical infection. When there is a domination made by agent, the disease comes in the clinical picture, in the clinical form. And when in some circumstances, the host overcomes the agent infection, then the disease is not present, or we can say that absence of disease. In the disease occurrence, three factors which play an important role. These are the time, place, and population. Time states when the disease is going to occur, and different circumstances, environmental conditions, which affects the disease distribution according to time, and that is known as temporal distribution. Place, where the disease is occurring, many geographical conditions, which affects the overall climatic condition also affects the distribution of disease. These are known as special, that is referred as special distribution. And the most important one is the population, and that disease also or infectious agents require a susceptible population for its occurrence, and where the population distribution play an important role. So we see the disease whenever there is an equilibrium between the host and agent, then the expected number of cases occur in a population at a particular point of time or in a particular place, and this situation is referred as endemic, or we can say the endemic pattern of disease. But whenever agent dominates the host, and then there is an increase in the number of cases beyond expected frequency. That means the cases are occurring more than the normal occurrence, normal frequency of disease. So this situation is referred as epidemic, or sometimes it is also referred as outbreak. And we all doing our efforts to remove the or make it possible to host overcome the agent infection or infectious agents to progress to help in to progress for the elimination of that particular disease from the environment. So what is outbreak? As I told you in the previous slide, that sudden increase in the number of cases of a disease beyond its expected frequency, that is also related with a point of time also. If the disease is occurring in a particular season, and like in the winter, and that disease occur in a dry or like hot summer situation, so again we can say that the disease outbreak is there. So it should be the expected frequency is also related with the time, place, and population also. Species is very important. If the disease is occurring in a new species, then the disease will be occurred in will be termed as an outbreak, or we can say that epidemic. So even the single case of a new pathogen in a specific new disease may be referred as the outbreak condition. In most of the outbreak situation, there is a linkage of two cases, and we can say that temporal clustering of cases in a particular situation or a particular place in that is seen in the outbreak condition. So outbreak may occur in a small or localized number of individual or the population, or it may occur or involve the many individual, many countries also, or even continent also. So it is very important to know the progress of disease from its endemic status to epidemic, and because by finding or like circumstances how this disease is becoming in or getting the status of outbreak and outbreak situation. If we detect the outbreak as early as possible, we can reduce the impact of the disease in a population in terms of not only the life, also socio economic impact is also there. Once the disease is beyond our hands, then that impact is very high and that cannot be reversed. So it is very important to detect an outbreak in the earlier uh, phase. This slide showing how the changes in this relation of or epidemiological triad causes the occurrence of a disease outbreak. When we plot a graph with the number of cases in the vertical axis and time in the horizontal axis, we can find the epidemic curve. And on the basis of the source of infection involved, there are number of epidemic or outbreak are there. If the source of epidemic, source of infection, or source of disease is common, and the exposure of that source to the population is very brief, so all individual will fall in one incubation period, and that is termed as the common source point epidemic. Another one is the continuous epidemic, common source continuous epidemic. And here the source is common, source of infection is common, but the exposure is over a period of time. And here the incubation period ranges, and it causes the flattening or that weakening of the peak of the epidemic curve. And here the example, the best example is the waterborne cholera, where the source is water, and the population is getting the or exposing to the that source of infection continuously. So this is the continuous epidemic, uh, common source continuous epidemic. Another one is the intermittent epidemic. When there is a exposure pattern is intermittent in nature, then this particular epidemic is referred as intermittent epidemic. Second one is the propagative epidemic. Like in most of the contagious disease, like highly contagious diseases and vector-borne diseases, there is a propagation, or we can say that the number of cases occurred in an exponential manner pattern, and there is a direct person-to-person contact or from the vector-borne disease transmission. So there is an number of, or like we can say that over more than one incubation period is there, and that is known as propagated epidemic. And when there is a source is common and spread is propagative, so this is referred as a mixed epidemic. Here we can see that the epidemic curve for the common source outbreak point source or common source point epidemic, we can see that there is a uh, uh, increase in there is a one peak, and then after that subside of the cases is there. While in the continuous epidemic, we can see that the number of peaks are there, and the exposure is very for over a long period. And then in the intermittent epidemic, there is a number of epidemic curve are there with the some time interval. And in the propagative epidemic, we can say that one person transmit the disease to another one, and the disease is progress in the exponential number. And then there is a propagative epidemic, where there is a incubation period. We can see in this graph that there is a progressive increase in the number of cases. And in the third mixed epidemic, we can see that there is a source is common. So there is one peak, and after that, these people, these individuals will transmit the disease and spread it in a propagative manner. So this is a mixed epidemic. So how can we decide whether the disease is in the outbreak condition or not? So there is a certain warning signs is there, and these warning signs indicate that the disease may progress or it may become in a outbreak form. So first and most important thing is that there is a linkage between the cases. So in relation to time as well as place, in a particular place, there is a temporal clustering of cases along with increase in number of cases as well as death. And in some circumstances where the disease is not reported or not endemic, or the expected frequency is 0 also. So if the one cases or single case occur, and then the situation referred as the outbreak condition. And then if the any of the illness arrive or occurred in a place and the etiology is not known, or the isolate is very unusual, then again the situation is of outbreak. There if we see that there is a changes in or shift in the overall species or age, or any of the breed also. So again, the occurrence of any disease in a new species again referred as a outbreak condition. And in the natural disaster, it is a very common situation of occurrence of outbreak. So what we do in the outbreak investigation and why it is important. During the situation of outbreak, it is thorough investigation is very much important, and that is referred as outbreak investigation. And in this outbreak investigation is the primary method of confirming the emerging infections, and it also inform us about the changes in the trends of any disease occurrence, disease pattern. It also provide information about 5W. And these 5W, like who is affected, when and where the disease is occurring, and what are the number of cases may occur or may arrive due to this disease, like incidence, prevalence, or like case fatality, how much people may die, or how much individual may die because of this disease. And the most important one is why that means why the disease is occurring in that particular place in a population. So what would be the source of infection, what was the source of origin of that outbreak, and how the disease spread in the population. So these are the questions, these are the 5W which are being asked during the investigation. And the information gathered by these questions, and during the outbreak investigation, we do the outbreak investigation further. And on the basis of that, we also find out that what were the loose ends in the existing preventive strategies, and how can we find and we also find the ways so that further future outbreaks can be prevented. So these are the aims and objective of in outbreak investigation, and by this we find out all these information. So this slide is showing the epidemiological steps of an outbreak investigation. These are the protocol, we can say that standard steps also, and we have to follow from in a sequence. So first and most important thing is the preparation of field work. We have to be prepared about the field work involved in the outbreak investigation. So we have to make a team. We also have to gather the resources also. And then after that, we also have to establish that there is an outbreak or not. So establishment of existence of outbreak is also very much important. Then after that, we have to confirm the disease by the confirmatory diagnosis. We also have to verify that this is the disease or this is an unusual illness which is occurring in the population. So on the basis, after that, on the basis of clinical manifestations and confirmatory diagnosis, we make a case definition. And once the case definition is there, after that, we go for the search for the information about 5 Ws, and the information provide an idea about the how or what would be the source of infection or source of origin of that outbreak. So on the basis of we prepare or perform the description of a disease, like which species is affected, what time the disease is occurring, and all the description related to the disease is being done in this descriptive epidemiology. So on the basis of all these information, hypothesis is being developed, and that hypothesis again these assumptions have to be tested and evaluated so that epidemiologically, so that we can go for a conclusion, and these conclusions help us in the development of like strategies for prevention and control measures. And then so after evaluation, if the hypothesis is not fit, then again we have to reconsider, refine, and reevaluate the hypothesis. And this hypothesis we have to analyze also uh, on the basis of laboratory and other environmental studies also, like case control or cohort studies and analytical studies. And on the basis of this in this like result or like uh, all the information conclusion, we can develop and or make strategies for control and prevention. And then the implementation is done so that the further outbreak can be stopped, or the spread of the disease can be stopped. And then further two are like we have to continuously monitor the situation and surveillance so that further outbreak further new cases are not there, not occurring. And we also have to communicate these findings so they can be the other people, the population, the public can uh, get the information, get the knowledge that this is the situation of outbreak. So uh, in the disease investigation or like outbreak investigation, the crucial steps are like to know the clinical manifestation or like a case definition, making of case definition. And second is the second crucial step is the gathering the information or to reach the conclusion of the to find out the answer of source of reason or transmission ways. So in this presentation, we are going to discuss some of the important disease of sheep and goat, and in relation in reference to their clinical manifestations and the ways of source and transmission and prevention and control measures to be adopted for the in the outbreak situation, these outbreak situation. So these are the common disease of sheep and goat caused by the viruses, some of which we are going to discuss. And these are the diseases of bacteria causing disease in sheep and goat. So the first criteria or first clinical manifestation, we can say that syndrome, which is commonly seen in many of the diseases of sheep and goat, is the respiratory manifestations. So these are the diseases which show the somehow similar manifestations, similar clinical signs like PPR, uh, parainfluenza, CAE, and cases of lymphadenitis. So some of which we are going to discuss. So first one is the small PPR, that is small ruminant plague, because of its ability to cause the high morbidity and its contagious nature. This is generally is in occur in an acute form, and it is highly contagious. And OI have categorized it as a notifiable disease, and it is also an economically important transboundary disease. In India, it also featured among the top 10 diseases, including PPR, sheep and goat pox, rabies, enterotoxemia, blue tongue, coccidiosis, babesiosis, thalidosis, foot rot, and fasciolosis in sheep and goat. And in among the viral disease, it stands fast because it accounts about 36% of the mortality among the total or reported deaths in the sheep and goat. And Government of India have also launched a centrally sponsored PPR control program in line with the PPR Global Control Eradication Strategies to control and eradication of PPR by 2030. So the clinical case of PPR is manifested by the high rise in temperature, dull coat, dry muzzle, and inappetence, and there is a profuse serous nasal discharge that is accompanied by sneezing and coughing, and these discharges become crust and mat the nasal and oral surroundings. And there is also involvement of oral cavity. There is a development of necrotic lesions in the lips, buccal mucosa, gums, and tongue with malodor, halitosis. There is also involvement of conjunctiva. There is a congestion in the conjunctival mucous membrane. And another one of the most important symptom is a sign of pneumonia, and that may lead to the respiratory failure and cause of death in the affected animal. And there is also the sign of diarrhea, and these direct feces may contain mucus and blood. And in the pregnant goat, we can also see the abortion. So now the case definition, we can say that this is in PPR, is an acute, highly contagious viral disease of small ruminants characterized by fever, loss of appetite, stomatitis, gastroenteritis, and pneumonitis. So we can see that there is involvement of respiratory system. There are also gastrointestinal system, upper respiratory system. So how the disease is transmitted? One of the most important thing is that this is reported markedly or most commonly found in the goat, and sheep are less susceptible to the disease. And the disease is transmitted through the direct contact with the secretions and excretions of the infected animal, as well as indirectly through the food, water, and other fomites. In the epidemic spread, the source of infection may be the considered as maybe the feces. And the most important point is that in this disease there is no carrier state. And so the how the disease comes in the herd or in a flock, it is most commonly because of introduction of newly purchased sick animal, and these sick animal may be of in subclinical state. So this might be the reason of the occurrence of any outbreak in a flock. The disease is transmitted mainly through the ingestion route, and less commonly also through the inhalation and contact route. There is the disease not at all transmitted by the insect vectors. In India, there is this information, this data I have collected from an report in a meta-analysis review, and that indicated that from in the India, this much outbreaks have been reported, and maximum highest reported from the goats, followed by sheep, and then some some flocks where the sheep and goat reported reared together also have these outbreaks. In the geographical distribution, South zone reported the highest number of outbreak, followed by East, North, and West, and Central Northeast region. So, and this there is no relation of outbreak occurrence with the any of the time of the year. It can occur any of the time of the year. So, in India, the situation is like I would like to show this picture also. So you can see that this is also a review. This information this photo I have taken from a review, and you can see that in the India no report of outbreak is there. So the situation in India is like uh, the most of the outbreak goes underreported or like unreported also. So but leave it. As per this review, we can see that there is a difference in the PPR outbreaks, PPR cases, and PPR deaths in distribution, in terms of distribution. So in the A image, we can see that the first for the distribution of PPR outbreak, first rank is of Karnataka, while the PPR cases distribution, first rank is like this northeastern countries, northeastern states, and then in the distribution of PPR death, again Karnataka is the first one. So there might be some reason behind this difference in the distribution of these uh, data. So how can we prevent it? The major thing in the case of outbreak, we have to first segregate or isolate the sick animal and treat them separately. And second one is the implementation of strict sanitation and hygienic measures. While for the prevention, we have to strictly follow the quarantine measures, and we also have to think about the introduction of new animal in the flock, particularly the area from the area where the disease is prevalent. So now I would like to uh, tell you that the PPR is mostly confused with which number of diseases. Like in the PPR, we found mouth lesions. So that can be confused with the blue tongue virus, contagious eczema, rinderpest, FMD disease. Pneumonic symptoms can be confused with the pneumonic pasteurellosis, contagious captain pleuropneumonia, and diarrheal symptoms can be confused with or we have to differentiate it PPR with the coccidiosis and other helminthic infestations. So the blue tongue. Again, this is a disease of small ruminants, and in which the disease is the clinical signs are like fever. There is a reddening and swelling of nose and oral mucosa and ear, which we have seen in the PPR also. And the differentiating feature is like inflammation or swelling of the submaxillary region, which gives it a monkey face appearance. And other symptoms again are similar to the PPR, like inflammation, ulceration of lips, gums, buccal mucosa, and tongue, and conjunctival mucous membrane congestion and nasal discharge. Again, the another differentiating point may be the appearance of blue tongue, cyanotic development or bluish appearance of the tongue. Second one is the tilting of neck towards the one side. It is also seen in many of the blue tongue cases. And third one is the lameness and reddening of the reddening and swelling of the coronary band. So these may be considered as a important symptoms which may help us in differentiating it from the PPR. There is again the similar diarrhea is there, dyspnea is there, and death again due to the respiratory failure. So the disease is acute, similar to the PPR, but it is infectious, but it is not contagious. And as I told you, the PPR is most commonly seen in the goat, but the blue tongue is most commonly the basically disease of sheep, particularly the young one, and it is caused by it is caused by RV virus and the transmitted by the insect. A vector is involved. So biological transmission is also there, mechanical transmission may be there, and there are some report of semen and placental route of transmission. And another feature of this virus is like this virus is very resistant also, so it can survive for longer duration. And dissimilar to the PPR, that PPR occur throughout the year, but this particular disease occur on the season, which facilitate or help in the propagation of the vector because it is transmitted through the vector. So the places, the conditions, environmental conditions which favor this particular propagation or breeding of the vector, that also facilitate the outbreak of this lutein disease. In the India, uh, it is general statement that this disease is of crossbreds or exotic breeds, but there are certain outbreaks which have been reported from the native breed of sheep also. So the highest prevalence have been reported from the Andhra Pradesh, and number of serotypes is also there, which make it difficult to control. And the factors which help in the transmission of the disease is like availability of susceptible livestock population, as it affects mostly in crossbreds or exotic breeds. Vector presence is also important, which decides distribution. Climatic condition like warm and humid climate, which facilitate or provide an ideal environment for the survival and multiplication of the virus in the lineages. And introduction of exotic breed in the flock is also make it prone to the occurrence of the outbreak and multiple serotypes. So for the control of outbreak, it is important to isolate the animal and follow the treatment and management. In the outbreak condition, one of the strategy which have been used previously, that is the test and slaughter, but in the Indian circumstances, it is very important to know what are the major obstacle, and the obstacles are like inadequate compensation to the owners for culling the infected animals, and that also encourages the owners to hide the infection, hide the infected animal also. So in the outbreak control strategy, there is a recommendation of creation of restriction zone during the condition of outbreak, and these zone help us in the control of outbreak or spread of outbreak uh, further. So in these zones, there is a ban or movement of the susceptible animal and their product, and 3 zones are being formed. An infected zone which extend up to 20-kilometer radius around the infected premises. Second, protection zone, and it extend up to 100-kilometer radius of the infected zone. And in this, epidemiological surveillance program is being implemented. And there is an also continuous serological monitoring of the sample ruminants is being done, carried out, and movement is restricted, while the vaccination can be done in the protection zone. And while in the surveillance zone, all these things are similar. And it extends up to at least 50-kilometer radius beyond the limit of protection zone. But the difference is that the vaccination is not allowed in this zone. So for the prevention and control, the most important point is the control of vector by various means. There are a number of ways which can help us in the control of the vector, as well as we can also avoid the grazing of our animal to these areas where there is a lot of vectors. And another most important point is that cattle may act as a carrier. Even the viremic stage is there for up to more than 5 weeks. So the in case of outbreak situation, the movement of cattle also should also be restricted. And other than this, we can also avoid the importation of animal from the areas where the disease is more prevalent. And we should also follow the strict rule and regulation. Another similar disease is of contagious eczema, and this also shows the similar kind of clinical signs. It is viral, infectious, is a pustular dermatitis. It affects the young sheep and goat, but the important point is it has a zoonotic potential, and it is transmitted by contact. The differentiating point may be the hyperkeratosis. There is a growth of tumor-like lesions in the affected areas. Mostly the oral cavity is involved, and also there is a involvement of some cornate joints is there. And similar to the gluten virus, this virus is highly resistant. It can survive up to 12 years. So again, we have to differentiate it with the blue tongue and PPR. And one of the most important differentiating disease to be differentiated is the ulcerative dermatosis, and which affect the adult animal, while the is most commonly seen in the younger animal. This may be the presumptively we can differentiate it. But again, further laboratory diagnosis is very important in all these diseases for the further confirmation. And pneumonic pasteurellosis, it is purely respiratory disease caused by a bacteria. And in this disease, there is respiratory signs is there, but there is no oral sign, oral lesions and diarrhea like like in case of PPR. But and that may be a differentiating point. But in case of pneumonic pasteurellosis, number of animal and death are lower compared to the PPR. And but sometimes in the case of PPR, there is no apparent oral lesions or diarrhea, so it may again cause the confusion. So it can be easily be uh, resolved by the using the isolation of bacteria in the and this is bacterial disease, so it can be easy to isolate the causative agent bacteria. But again, in most of the circumstances, the differentiation or cause of disease or cause of outbreak is very difficult. So in a situation where the PPR is also prevalent, in that cases we have to, for the control or treatment of the disease, we have to test all the suspected cases of pneumonic pasteurellosis, so that proper effective measures of treatment can be applied. In case of another similar disease is contagious caprine pleuropneumonia. It is highly contagious respiratory disease of small ruminants, similar signs, and here it is also a notifiable disease. And in this case, the domestic goats are primary host, but sheep can also be affected, which are in close contact with the goats. And like PPR, in this there is a fever, respiratory involvement, but there is mouth lesion and diarrhea is not present in the CCPP. So further, the laboratory diagnosis to be done for the confirmation. In case of pathogenicity of CCPP, there is a involvement, strictly the involvement of lungs and pleura is very strict. And then high morbidity, about 100% animals will be affected, and mortality rate is also high. And another similar disease, like in case of ORF is all caused by the pox virus, and sheep pox and goat pox is a similar disease to the to the ORF. But the differentiating point, while in ORF, the most of the lesions are found on the oral or mouth area, while in this disease, the lesions are maybe in all over the body, where there is a wool or hair are very less in number, like faces, ear, axilla, groin, any of the area, their lesions may be found. And these lesions are very specific, and they show a clear cut pattern of development of pox lesion. So but in this case also mortality may be very high, up to 50%. And in this, transmission is direct contact with the secretions, nasal secretions and excretions. And fomi transmission may also be there. And again, it is these virus may be present for long time. So these scab or the secretions or fomites may remain infective for a very long time. And another anthrax which have a clear-cut clinical manifestation, so it is not very much difficult to identify, but I have included this disease as it have peculiar source of reason or the source of infection, and this particular disease occur particularly in the area, in the situation where the animals are allowed to graze in a contaminated pasture, and particularly the pasture or contaminated soil where there is an heavy rainfall or flooding is there. So these are the very uh, area from the disease can be acquired. And there is also some area or places where the disease is endemic in India, like in the states of Odisha and Andhra Pradesh, and there is an epidemic zone. And because of geographical conditions, these are the risk factors which help in the further or occurrence of the disease, like rainfall. These high rainfall and high moisture content in the soil help in the germination of insect spores. Even in the dry area also, if high winds are there, then these spores can be spread to further distant areas. Vegetation, like if the in particularly in the dry season, if the animal the grass or like pasture is not there, so these animal graze on closer to the ground, and they increases the chances of the exposure to the insect spores. And again, temperature is also there. High salinity is inhibit the sporulation of insect spores, and oxygen also inhibiting the this germination. And then management, it is very important. It is zoonotic disease, so to safeguard the our livestock and public, there is certain things we have to consider, like notification, quarantine, disinfection, proper disposal, surveillance, and vaccination. And prevention and control we is there in for the anthrax. Another disease of importance in case of small ruminants is the listeriosis, and it is somehow different from the this shows different signs and symptoms, and it involves the neurological symptoms and abortion in case of sheep, particularly sheep. So this listeriosis is caused by the bacteria Listeria monocytogenes. It is also of zoonotic significance, and this disease showed three forms. Encephalitic form is most important and most common, where there is an death within 20 to 24 to 48 hours after the appearance of symptoms. And in this disease, we can see that there is a unilateral involvement of cranial nerve, and there is a development of flaccid paralysis, which lead to the dropping of ear, eyelid, deviated muscles, lowered eyelid, and decreased lip tone also. So there is a dropping of jaw, and this lead to the profuse salivation, particularly from the side where there is a facial paralysis, and tilting of head is also circling movement is also there, where of which this nerve is involved. So in abortion form, uh, the most of the sign are not that much um diagnostic, and it can also only be diagnosed by the laboratory findings. But we can say that the most of that abortion occur in the last trimester without any prior clinical signs and symptoms, and the abortion rate may extend up to may reach up to the 20%. And sometimes the septicemia may be there in the dam, and uh, metritis and mastitis condition may lead to the excretion of the agent bacteria into the milk, and that is important from zoonosis point of view. So what would be the source of infection for the listeriosis? It is very clear cut indication of feeding of moldy and spoiled hay or silage, which is not properly fermented and acidified. And in most of the situation, this is the most important source of infection for the of the listeriosis in the sheep and goat. And it may continue because of improper cleaning of feed bunks and remains of leftover and feces in these feed bunks. So they may be the source of infection further for the further spread. And the distribution of disease and risk factors involves a sudden change in diet and all these factors which may facilitate or may predispose the animal to get the infection. So for the prevention and control, first and most important thing is to avoid or do not feed the spoiled feeds to the animal, and the newly imported animals should be quarantined first. During outbreak, the infected animal should be isolated, and now the symptoms of listeriosis we have to be differentiated with the cynorrhosis and osteoarthritis and scrapie and gaseous caprine arthritis encephalitis virus and polioencephalomalacia. So scrapie is prion disease and the incubation period is very high in this disease. So laboratory diagnosis to be done. And in case of caprine arthritis encephalitis virus, it mostly affect the young kids or young goats of up to 2 to 4 months of age. And the polioencephalomalacia, it may be involved in or in the development of sign and symptoms. It may be coincide with these neurological diseases, and it is because of ingestion of some concentrates which have a lot of thymidinase enzyme which causes the development or like production of the vitamin B. So you have to consider it for the differentiation with the listeriosis. Next is the enterotoxemia, and it also shows some of the neurological symptoms. And in this case, the outbreak are very explosive, and the mortality may extend up to 10 to 40%. And there is a sudden death without any clinical sign, and there is a development of bloat in which may lead to the difficulty in breathing. And neurological symptoms includes the trembling, stiff limb, convulsions. So they may create some confusion with the listeriosis. And in the goat, it occurs in four forms: paracute form, acute form, and subacute and chronic form. So in this, you can see that fever is only there in the acute form only, and after that it subsides in paracute form only. So after that it subsides. And for the enterotoxemia, the source may be the sudden changes in diet. And in normal circumstances, this bacteria, the cause of the enterotoxemia is there. Uh, is found in the intestine in low in number, and also it is also present in soil. But the other factors like change in diet, ingestion of high quality rough forages in a lot of amount, that causes that facilitate or that develop the conditions which facilitate the overgrowth of this particular bacteria, and it releases the toxin which um, uh, causes the pathophysiology of the disease. So these are the risk factors. Now there is a for efficient vaccine is there, and but again the immunity is not very long term immunity. So the in some circumstances we have to give the booster more frequently. and you can also do you can also follow the proper management of gradual diet transition and cleaning and hygiene conditions. And these some other diseases of which causes the abortion in sheep and goat. So because of time, I could not include all these diseases. So in considering or by going through all these diseases, the most important point is the proper management in control and prevention of any of the disease. These are the points which have to be followed in the management. Thank you.